The American Brain Tumor Association is pleased to welcome you back to our webinar series. Again, our webinar today will discuss coping with caregiver stress. My name is Jennifer Westland, and I'm the Associate Director of National Programs and Services here at the American Brain Tumor Association, and I'm really delighted to introduce our speaker. Ashley Varner, in addition to having an MBA, she's also a master's level social worker and currently works as an oncology social worker for the DeSeris Cancer Institute at Anne Arundel Medical Center in Annapolis, Maryland. Previously, she was Senior Director of Caregiving Programs for the nonprofit organization Cancer Support Community, and also the Senior Clinical Neuro-Oncology Social Worker with the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins. Her professional expertise includes the study of the experience of those with a loved one diagnosed with cancer, as well as the use of spirituality and religion as ways to cope with cancer. She's currently pursuing a PhD in social work, and she was recently awarded the American Cancer Society doctoral grant, and her dissertation will focus on the experience of those with a loved one with a brain tumor. So really a perfect person to be giving this talk today. Ashley's received the Neuro-Oncology Social Worker of the Year Award from the National Brain Tumor Society and the Stegman Memorial Award by the Johns Hopkins Carey School of Business. And she's sought after nationally to speak both to lay and professional audiences about a number of different topics, including caregiving. And she's most passionate about providing support to those who have a loved one with a brain tumor. So again, we're so pleased to welcome Ashley. And Ashley, you can go ahead and begin your presentation.
Thank you very much, Jennifer. I really appreciate it. And I'm so excited to be here today. And I thank you, Jennifer, and ABTA for inviting me to present. But more than that, for having a session on brain tumor caregiving and on coping with caregiver stress, because it's a very important topic and it's hard to find information out there about it a lot of times. As Jennifer said, our focus today is on those affected by brain cancer who may not actually have cancer, the loved ones of those with a brain tumor. And our goal, or my goal, is to provide some tools for caregivers and ultimately by way of that, for those who've been diagnosed with brain cancer, to be able to navigate this journey just a little bit more smoothly. What I tell folks that I have the privilege of working with is that we know it's going to be a bumpy course. That's by definition, being diagnosed with a brain tumor or having a loved one diagnosed with a brain tumor is a bumpy course. But hopefully we can use today to predict some of the speed bumps so that you don't go flying over them at 60 miles an hour, but in fact you just ease up to them and ease over them, and it might still be a bump, but it's not the teeth jarring, the teeth rattling part that can happen when you don't see that speed bump coming. So just to get started and making sure that we're all on the same page, I thought we'd talk a little bit about who's a caregiver. And on the one hand, I think that seems pretty obvious, and certainly I imagine I'm preaching to the choir today because you chose to come to a session entitled Coping with Caregiver Stress. On the other hand, I think it's important to think about because research tells us that we don't always realize that being a caregiver is a distinct role, separate from being a spouse, an adult child, a parent, a sibling, a friend, or a coworker. In fact, we do both at the same time, and sometimes they can be conflicting roles. So a caregiver is anyone who provides physical, emotional, spiritual, financial, or logistical support to a loved one with a chronic, disabling, or life-threatening illness. Caregiver has become the most used term, I guess, for this role in the medical arena, but it often doesn't fit for caregivers. So a lot of folks tell me, and you may feel this way, that that term doesn't resonate with me. Many think of themselves in other terms: loved one, husband, wife, daughter, son, mother, father, colleague, friend. And there are also other terms that have been suggested. So when I was at Cancer Support Community, I had the privilege of doing a very small research study, just asking about 200 folks with cancer or with a loved one with cancer what they would what was the best name for caregiver, if you will. And what we got back, I was hoping for a consensus, and no such luck. There was no consensus, but folks suggested advocate, co-survivor, lay caregiver, family caregiver, and we also know that in the United Kingdom, the role is often referred to as carer. So everyone is affected by brain cancer, right? Not just the person diagnosed, but everyone in the family, friends, all of those in your social circle, and anybody that really cares about the person who's received a brain tumor diagnosis. And I saw in your questions, I saw a lot of this, the questions that you all submitted or the comments that you submitted in your registration materials. We have present today spouses, friends, children, and even brain tumor patients who are themselves coping with their own tumor, but also taking care of another person with a tumor. And we often see this because folks will meet in brain tumor support groups or in other arenas and become close. There's nobody that can understand like another caregiver or another survivor. So if you would, take just a moment to think about the following questions. Can you be a caregiver or a co-survivor if you live a long distance from your loved one? How about if you have cancer yourself? How about if your loved one is entirely self-sufficient, drives herself to treatment, doesn't want any help? What about if your loved one doesn't like the term caregiver? I have many folks that I work with who really hate that term, and some who even refuse care. And we particularly see that sometimes with folks who are afraid of losing their independence. Are you still a caregiver in these situations? I would say absolutely. Indeed, these situations can be some of the most difficult situations to care about somebody who has a brain tumor. So who are America's caregivers? And this is a bit of background material, and I won't go into great detail about it. And the information here is about all caregivers, not just cancer caregivers, which is why the child piece of the pie is slightly larger in this particular graph. But what I think is really important and why I added this slide is that it's really important to realize that anyone can be a caregiver. And in a recent study, or a not so recent study, but one of the first studies about cancer caregiving, 36% of folks reported that caregiving took more than 40 hours of time per week. And I bet if you all stop and think about it, that some of you will find that when you add up all the bits and pieces throughout the day, not just when you're with your loved one, but when you're also on the phone making phone calls about this appointment or picking up this prescription, that it is quite a bit of time. And we know anecdotally that that's particularly true in the for caregivers of folks with brain tumors in particular, because so often, depending on where the tumor is and the stage of the disease, brain tumor caregivers require a greater amount of supervision. And in that same study, we looked at what do you do as a cancer caregiver? And I think the real question then is, what don't you do? Folks told me that they prepare meals, they clean, they provide transportation, they talk to healthcare providers. That was a huge one. They administer medication, or they make sure that their loved one is taking the medication, even if their loved one is taking it themselves. They make sure that their loved one is getting everything they need. And perhaps one of the more time-consuming pieces that some people told me about was running interference with all of the loved ones and others who want to know how things are going, and figuring out who to tell what and repeating the same story a number of times. And we'll talk a little bit about ways that you can manage that and manage that stress. Some of the consequences of cancer caregiving detailed in this Journal of Family Nursing study were that that caregiving definitely has an impact on the physical, emotional, and financial health of the caregiver. And the results really are staggering. I guess in that particular study, 70% of folks said that they took between 70% of the caregivers said they took between 1 and 10 medications per day. And 65% said that their own health had suffered as a result of caregiving. Now, this is an old study, so we've come a little ways since then, but I do think it's important. And it's important because, and I suspect I'm preaching to the choir here, because those of you on the call chose to spend an hour of your day today learning about coping with caregiver stress. But we do actually know from research that caregivers who don't take care of themselves put themselves at risk for not being able to take care of anyone. We know that caregivers providing support to a spouse who report strain from doing so are 63% more likely to die within 4 years than others their age. And in this finding, I highlighted who report strain from doing so because I think it's really important to recognize that as caregivers, we have a responsibility to do what y'all are doing today, which is learn how to cope with caregiver stress and caregiver strain. It is a learned skill. We also know that in a different study, and this study was done with women with breast cancer, but I see this across all diagnoses, that partners of women with breast cancer find that their mental health correlates positively with the anxiety, depression, fatigue, and symptom distress of their loved one, and that the effects are bidirectional. So that's all very fancy language that I quoted out of a paper, and I think it's kind of a confusing way to say it, but what it boils down to is that our mental health, both of patients and of caregivers, track in tandem. That is, they're synergistic, and when your loved one feels good, you tend to feel good, and I bet you might have even said that somewhere along the way. But when you feel good, your loved one feels good. So managing caregiver stress helps everyone. And in fact, how often have you heard folks say, maybe your loved one has said to you, that they worry about you just like you worry about them. You don't stop worrying just because you have a brain tumor diagnosis. We know that that caregivers are affected in a number of different ways. They report, or you report, I report, high levels of psychological burden and feelings of helplessness and loss of control. And I saw that in the comments in your registration material. Somebody commented that he can't fix this, and he's in a profession where he's used to being able to fix things. And it's a fairly high-stress profession, but he's really learned how to fix things, and darn it, he can't fix a brain tumor, and that he feels pretty helpless around that. A lot of times folks will report to me that they feel that unwanted aloneness, that they really want to connect with folks, but they feel like nobody can really understand. Having to make decisions for the patient is a huge piece that I hear from folks who are looking after somebody with a brain tumor, and we'll talk a little bit more about that later in the hour. And being expected to provide encouragement and companionship is another one. We also see guilt and reactions of anger and sadness among all cancer co-survivors. But I think there's a lot more to it, and many folks have really wonderful things to share. So before we get too far down the burden, I do want to just bring up the really positive things that there are to get, because some of coping with caregiver stress is finding that balance in how you look at the whole situation. Much easier said than done, by the way. I do recognize that. So you can think about how you've been affected by being a caregiver. What I hear a lot is that folks report a deeper connection with their loved one. I very often hear both from brain tumor survivors and from their loved ones that priorities become very clear. For instance, in one of the support groups I facilitate, one couple chose to get married and plan their wedding just exactly how they wanted it to be. And they had been engaged previously and were sort of in the throes, and many of you may recognize this, of every family member thinking that they knew the best way for that wedding to turn out. And with the brain tumor diagnosis came a decision on their part that they were going to get married how they wanted to get married. and which was actually to go to the courthouse and get hitched. They didn't really want a lot of fanfare, and then they came back and had a big party afterwards. Another gentleman who's a 15-year glioblastoma survivor shares frequently that his clarity about how he will handle his life and his health care really came through at the time of his diagnosis. And you may recognize that since he's quite a ways out from diagnosis, that things like Tumor didn't exist when he was diagnosed. And so he had really challenging time with chemotherapy, but he chose to do it, and he's obviously very glad that he did. He'll often say in group, "I want to live, and it's up to me to make sure I get the care I need." So that very clear sense of a priority. Folks also talk about better communication. That may or may not be true when living with somebody who has a brain tumor. If the tumor is located in a place that causes aphasia or difficulty with word finding, and often that can happen sometimes because of the tumor, as you know, but also sometimes because of, as a side effect of surgery that will, in fact, get better over time. Communication may be more difficult, but there's definitely a greater intention to communicate that I hear almost universally from the folks that I have the privilege of working with. There's a stronger commitment, and commitment to what? A commitment to life, a commitment to the relationship, a commitment to living life the way they want to, and a commitment to self. And many people talk to me about, as a result of these other 4 things, that they have an increased sense of self, that they know who they are and what they want. So caring for somebody with a brain tumor is obviously not all bad. And not all about the burdens, and we'll talk some about the models that have been suggested in a moment. One quote, and there are obviously many of these, and each of you, I bet, could tell me one. So sometimes it's kind of fun to think about what your quote would be, but this woman who gave me permission to share this quote said to me one day, "We had a strong relationship before he was diagnosed with a brain tumor, and it was a glioblastoma. But it's gotten so much stronger. We have to count on each other in a different way now, and our relationships with our friends and extended family are stronger as well. I didn't know how many people cared about us, but every time I go to my Lifeline," and that's a medical blog, so many people have responded and sent their care. And I'll talk about it a little bit more later in the hour, but my Lifeline, Care Pages, Caring Bridge, and other medical blogs are places where you can begin to post what's going on with your loved one. They're internet sites that allow you to keep in touch with loved ones in a semi-private way, because you have to actually invite others to have permission to view your site, or you can set it up that way. You don't have to, but you can set it up that way. And you can share what's going on with you as a caregiver as well as with your loved one. And they're a very concrete way to reduce caregiver stress. Also in the internet realm, I saw someone suggested the Inspire website in their registration comments. And if you haven't found this site yet, it's inspire.com, I think. It may be Inspire, no, it's inspire.com, I believe. But if the person who commented is out there, they can type that in the comments for afterwards, and we can make sure people have that site. But it's an online bulletin board where you can join groups that are of particular interest to you. And they do have groups specific to brain tumors, and you can meet others that are in similar situations. These can be enormously helpful, particularly for conditions like brain tumors and caring for somebody with a brain tumor, because since it's a relatively rare diagnosis, there may not be others locally coping with this same situation. And it's important with sites like Inspire to remember that the opinions expressed there may or may not be grounded in evidence-based medicine. They're certainly grounded in wanting to share what's worked for another caregiver, and there's nobody, or another person with a brain tumor, and there's nobody like somebody in the same situation to really be seeking out solutions. But it's always good to vet the material you get and really make sure that it's going to work for you. You can check it out with knowledgeable professionals or just take it with a grain of salt until you've had a chance to think through it. So we know now, right, that there are both challenges and benefits to the caregiving process. And we know that most of us haven't had any practice or experience caring for somebody with a brain tumor before we're thrust into the role. So we may not know how to do it or even how to think about it. So one important piece, maybe a very important piece of coping with caregiver stress is to realize that there are really two major tasks involved in caregiving. The obvious one is taking care of your loved one. That's the making the appointments, the taking notes, the doing research on treatment options, the organizing treatment, the paying the bills, the fixing the meals, and the list goes on. But the second major task of caregiving is the one that's often overlooked, and it's taking care of yourself. And as we said before, if you don't take care of yourself, it's very hard to take care of anyone else. So there are a couple of different models that people use to think about the caregiving role. And the first model is the one that folks often come to intuitively. And it's the zero-sum game, if you will, which suggests that if you are taking care of yourself, then by definition you can't be taking care of others, and that if you're taking care of others, you can't be taking care of yourself. And you might just take a minute, and when I say it that way, it becomes very clear that that's not true, right? It's both and, not either or. But if you take a minute to think about whether you might sometimes unwittingly buy into this model, I think you might find sometimes that you do. Frankly, I sometimes catch myself here. I'll think, I need to do this thing for my friend, colleague, client, family member before I do X for myself. So I'm still thinking I'm going to do X for myself. I'm going to just do this other thing first. But then I get to the end of the day, and somehow I haven't gotten around to doing that item for myself. And it's incredibly seductive. I don't consciously put myself behind everyone else, but in reality, that's how it plays out. And that's how this model plays out. And this is really the major source of caregiver stress right here, is that sort of unconscious putting ourselves behind others. So if you think about it, I bet some of you on the call do that as well, although taking time out for this webinar today, as I said earlier, is a wonderful way to take time for yourself. The second model is the one that I want to propose, and it was first proposed by Ms. Ahmed, Dr. Ahmed, who works at UCLA. She's a professor there, and she presents caregiving as a triangle with tasks, burdens, and joys or support on the three sides of the triangle. And her suggestion is that caregivers can broaden their joys and especially their support such that they are better able to complete the tasks and burdens without getting tired. And visually here you can see that the length of the side for the joys and supports grows longer than either of the tasks or the burdens. And this really is the model that I'd like to suggest, that coping with caregiver stress is about increasing the various types of support in your life, not just from people, but also technological support, the blogs that we were talking about, the medical care team support, spiritual support, etc. So how do we do this? Well, if only it were that easy. It's just something I do every day at 5 o'clock to get rid of stress before I go home. And he's vacuuming out his head. In part, I put this slide in because I've had more than one caregiver over time tell me that they thought that they had a lot of stress at work, but that once they took on the caregiving role, work was their relief. But the ABCs of caregiving are awareness, balance, and connection. And that's just an easy way to think about it. The awareness piece is that you are a caregiver, and that brings a new set of demands and opportunities. Without recognizing that you've taken on a new role, it's very difficult to learn more about it and how to manage the situation most effectively. Just like survivors must learn a new language, so must caregivers, right? So you might never have heard the word glioblastoma or astrocytoma before diagnosis, and certainly the chemotherapy names were new, but you learned them. Similarly, you have to learn the language of caregiving, awareness, balance, and connection to start, but there are other terms like co-survivor, saying, yes, I'll accept your help, would you please help me, and others that will be specific to you. The second part of awareness is recognizing what you're feeling. The brain cancer or brain tumor journey is a marathon rather than a sprint. At the time of diagnosis, we tend to put everything to the side and focus strictly on what to do next with regard to the cancer, whether it's a brain tumor or something else. But as a pair, it's important to also realize that this is going to be an ongoing journey. We know from crisis theory that one can only sustain the crisis response for about 6 weeks at most. That's enough to get through the diagnostic process, that 6-week period, that first inkling that something more than a bad headache is wrong, or that time from that seizure that says that's the alert, the red alert or the red flag, or the visual changes. But it's not going to, that 6-week period is obviously not enough time to sustain the whole journey. So listening to yourself when you're tired or need to take some time for yourself or distract yourself and pacing for the long haul are important. And getting used to what some refer to as the new normal is also really important. And the thing with the new normal is that it's always shifting. But one thing is usually clear. It's not the old normal. Life after a brain tumor is diagnosed is different than before. And that seems patently obvious, right? But often folks want more than anything to go back to the life they had before, which is incredibly understandable, but probably not all that realistic. Sometimes just recognizing that life is different and that we may not be able to do all the things that we were doing before can reduce the stress of caregiving. So maybe your house won't be as spotless as it was before, or maybe you won't cook dinner every night. But being realistic with goals and expectations reduces the stress level. And along those lines, I had a client bring this comic to me one day, and at the bottom it says, "I'm really behind on all my living." She had seen it online and commented that it really spoke to everything she was feeling. I've since been told by others that they don't think I should include this in my slide deck for topics around caregiving. But what it meant to her, and I really resonated with what it meant to her, was that she was so busy with all the new tasks that had come with the brain tumor diagnosis that her loved one had received, that everything else had fallen to the wayside. And what she took away from this cartoon was that her new normal was that living could be defined differently, and she could let go of some of the things that she used to think she had to do. And I remember that one of those things for her in particular was that she had been brought up to believe that fixing dinner every night and eating as a family was enormously important. And she realized it wasn't all or nothing, but that she didn't have to fix dinner 7 nights a week anymore, that she could buy fast food once in a while, and that it wasn't going to kill anybody. Another comic that I put in just for folks to think about is this one, which is all about listening to yourself and the awareness of what you're feeling. So whether it's in prayer or just in that moment when someone has asked you to do yet one more thing, or you go to the doctor and you go for your radiation appointment, your loved one's radiation appointment, and they tell you that the machine is down and you already have a busy day planned. I think we've all had this feeling of overwhelm, just enough, like I can't take one more thing. And the awareness piece of this is that this feeling is really important. Sometimes I work with caregivers and they feel that they just have way too much to do to pay attention to this feeling. And yet this feeling is the very important warning sign that it's time to take a little time out, which leads us to the B of the ABCs, balance. So Emerson tells us it is one of the most beautiful compensations of this life that no man can sincerely try to help another without helping himself first. And it's really crucial that each of us take care of ourselves just as much as we take care of those we love. It can be so tempting for some of us to put ourselves at the bottom of the list, but as Emerson notes, we can't help ourselves if we're empty. I'm sorry, we can't help others if we ourselves are empty. And I see this in a really practical way. So I imagine that I'm not telling you anything you don't know, although maybe I'm reminding you of something you haven't thought about in a while. But I do see it in practical ways. On more than one occasion, I've had a caregiver who has somebody who had a loved one with a brain tumor drop by my office and report to me that they succeeded in getting out of the house that weekend to do something for themselves, but also report that they noticed when they got back that they and their loved one got along a lot better, that it was really a relief for both of them just to have a little time away from each other. And that may sound familiar. I think it's intuitive, but it's easy to forget in the stressful times of trying to get everything done and make sure that, and just not knowing what the next right thing to do is sometimes. I've also heard from caregivers on more than one occasion that after an afternoon or a few hours away, they came back and noticed changes in their loved one's condition that they hadn't been able to see prior to the gap in time. And those come in two different arenas, if you will. Sometimes what caregivers will report to me is that their loved one actually figured out how to do some things that if the caregiver had been there, they would have asked their caregiver to do, and that both folks were really excited about that there was a real feeling of empowerment with that. And sometimes caregivers have told me that they noticed a physical change of some kind that they were concerned about, but that they didn't believe they would have seen it had they been staying there 100% of the time. So the upshot here is that self-care is really a win-win, that it takes care of both you as a caregiver, but also your loved one. So a little bit of talk about self-care, and this is perhaps the take-home slide of the whole deck. Self-care is a term that many of us are not familiar with, but it's exactly what it sounds like. It's taking time to take care of yourself and to meet your own needs and wants. If you would, take just a few seconds now to think about what you do to figuratively feed yourself. When you really need to take a break, what do you do for yourself? And you can think about it in 4 quadrants if you want: physical, psychological, emotional, and at your workplace or in your work environment. So these are some of the ones that have come up frequently, but it's helpful for you to look at what you notice that you do, because that's going to be the most important piece. You know, I believe we all have the answers inside us, but we have to take time to listen to them. But physically, people tell me that sleep is huge, that eating well is huge. We can tend to go to quick energy sometimes or comfort food, and there's nothing necessarily wrong with that, but a lot of it will ultimately make our blood sugar run all over the place and make us not feel as good. Stretching is really important. And perhaps of all of these under physical, exercise is the one with as much proven benefit as any of the others. Exercise is just as or more effective than antidepressants for working around depression, and it's an amazing stress reliever. Emotionally, people talk to me about spending time with their friends, laughing, crying, using humor, finding the humor in situations and allowing it to come through, and gratitude lists are huge for folks. Somebody said to me recently, it was a challenge actually. It was somebody that I was seeing who didn't have a brain tumor but had another kind of cancer, but she said, just try to feel bad about life and write a gratitude list at the same time. And I thought it was a funny comment, but it's true. It's very hard to be grateful and not be happy about life at the same time. Psychologically, people will be reflective. They'll do pleasure reading, Saying no can be a huge one, or help can be another huge one. Smiling, laughing, taking time out for yourself. And in the workplace, people talk to me about setting limits at work, peer support, taking vacations, and also enjoying the break from caregiving when they're at work. Some more self-care strategies that are specific to the holidays. Don't try to do it all. No one can do it all. Whether you're living with somebody with a brain tumor, you have a brain tumor, nobody can do it all with the holidays, says somebody who's just been through the holidays. Decide as a family what you most want to do and pursue that. Think about those priorities. Be clear with extended family and friends about your wishes and any limitations. Ration your energy. Take advantage of cancer perks. I don't know if anybody's heard the term cancer perks. I bet you have. I hear it most often in my young adult cancer support group. But cancer perks are those things that you get because people don't know what else to do when you have cancer or a brain tumor. So the young adults that I work with, and certainly some of the teenagers that I've worked with, it's the Make-A-Wish, and another young adult group said it was not being carded at the bars. But take advantage of them. It can also be using the electric cart at the airport, so that you're not having to walk down huge concourses. And it can be boarding early, so you get the best seat on the plane. Take advantage of what you can to ration your own energy so that you can use that energy in other ways. And of course, keeping plans flexible is really important. Some very concrete questions to consider when you're trying to find balance in the midst of a brain tumor diagnosis and treatment are the following. How can you help maintain the stability of home and family? How can you help ensure family income is maintained? Can you manage the physical care needed? What will help you tolerate the medicalization of your home? And who else can assist and how? And of these, the most important one in many ways is the who else can assist and how. But the others are important for answering the how part of that. What do you need help with? And it's important that you and your loved one have a chance to talk about this together and decide together how to access support. It can be very important in this process to reframe accepting help not as having to accept help, but as choosing to accept help. It's very difficult for most of us to accept assistance, but that is one of the crucial pieces of reducing caregiver stress. You might be able to do, you very well might be able to do this alone, but it will be exhausting. And the question I often ask is, why would you do it alone when you can connect with others through accepting help? Because they really do want to help. If you think, put the shoe on the other foot, when you have somebody that is going through a tough time, I generally want to help them. So now I'd like for you to take a moment just to think about what you do when you're feeling overwhelmed. If you're jotting these down, you can jot it on the same list where you jotted before what you do for self-care. And yours are the most important, but I'll give you some of the ones that I've heard over time. Folks tell me that they increase their social support even more, that they maintain task-focused behaviors, and that means making checklists or partializing. So it can feel really overwhelming thinking about, oh my gosh, I don't know how I'm going to do this for the next, how I'm going to make it through treatment for the next 6 months or a year, or my loved one's treatment, but really it's both of our treatments in many ways. But you can focus on today, so just taking one day at a time, or this week. Okay, how are we going to get to radiation this week? Who's going to take my loved one because I have to go to work? Or how can I arrange my work schedule this week, or even just today? Taking a time out, giving yourself a little bit of a breather, a little bit of distance from the situation so you can see it more clearly. Managing emotions through cognitive self-talk. So this is the, for those of you who have a a psychology background. This is the cognitive therapy or the cognitive behavior therapy. Recognizing the automatic thoughts that you have. I'll never be able to do that, and shifting it, and getting out of yourself. I also heard recently at a conference somebody was speaking, and she talked about, with regard to friends and social support, she talked about FDR friends. And FDR friends, she was talking about connection and how to best connect with people. And her model is that you divide your friends up into 3 different categories, if you will. Your feeling friends, who are the friends that can really tolerate feeling, and that they're your go-to friends. When you're feeling really sad, you know that you can call up and share exactly where you are, and they'll get it. They'll absolutely get it. And then she said, you know, the D in FDR was your doing friends. The friends that are really good at doing things for you or with you. So if you want to go to a movie, you can call them up and they'll absolutely do that. If you need somebody to go to the grocery store for you, they'll absolutely do that. But if you call them up to talk about feelings, they may not be able to meet you there. They may not feel comfortable enough with feelings to be able to support you in that way. And then the R of FDR stands for respite friends. And respite friends are the friends that you call when you don't want to talk about yourself because you know they're going to talk about themselves. And her point in describing this model was that it's really helpful to think about who fits into what category, because then you don't find yourself going to the hardware store to pick up milk. You don't find yourself reaching out to your doing friends or to your respite friends when you really want to talk about your feelings, because that's not really going to work. So that gets us into connection, the C of the ABCs of caregiving. And Jack Kornfield, who's the fellow who first wrote Chicken Soup for the Soul, says when we get too caught up in the busyness of the world, we lose connection with one another and ourselves. And perhaps all of us have experienced times when we are moving so fast to get everything done that we don't have much time for friends or to connect with each other. But that connection is one of the surest ways to reduce caregiver stress. And perhaps if you think about it, you can relate to the times when you have talked with someone and shared honestly and left feeling lighter, even though nothing really changed. And part of connection is thinking about how you connect with others. So a little bit about the differences in the ways that men and women connect, or the more feminine and the more masculine ways of connecting, because I've certainly seen women who like to fix things and focus on fixing things, and I've seen men who really, really want that emotional connection. But in general, men want to fix things. That's really the more masculine approach. And again, one of the comments coming in, actually 2 different comments from the registrations were about, how do I fix this? I can't deal with the fact that I'm having trouble, or I'm struggling to deal with the fact that I can't fix it. And women very often appreciate problem solving, but they don't feel valued without that emotional connection. And so knowing that and just recognizing it and recognizing what kinds of connection you need and what kind your primary caregiver needs is a wonderful way to enhance the connection. It really does deepen the connection. Some strategies for connecting: be responsive to your loved one. Take the time to ask what he or she really wants. What do they actually want? One of the tricky parts is making assumptions. Even if you've been together forever and you really think you know what they want, asking can be most helpful. Have a list of tasks available to offer when people say, how can I help, or what can I do, or let me know if I can do anything. And you have technological resources available to you. There's a calendar function on the mylifeline.org website, which is one of the medical blogs I was talking about. Lots of Helping Hands also has a calendar blog, a calendar function. And you can actually use the calendar to say, we need people to take Jimmy to soccer practice on Monday, Wednesday, and Friday, and somebody to fix dinner for us on Tuesday and Thursday, somebody to take Mike to radiation therapy at 11 in the morning or whatever, Monday through Friday, and people can sign up, and that's a pretty neat function. And think about playing on a team rather than trying to be a one-person show. Think about, and your team can include people that you may not have thought of, friends and family, of course, and your medical team members, and be sure to expand that past your physicians to the nurses that work with them and the social workers and patient advocates, others in that system. But also your insurance case manager. They can do amazing things in terms of shifting benefits. But they have to get to know you. And not every insurance company assigns case managers, but most of them do, particularly in situations like a brain tumor. And I have had clients who no longer had a rehab benefit, for instance, but their case manager, when they called up to speak with their insurance case manager found a way to shift some benefits to create a rehab benefit so that their loved one could go to rehab after brain tumor surgery. The other thing I'll mention here is that one of the really concrete pieces that people often say is that they have found a friend to help with the financial end of the brain tumor experience in terms of just keeping the bills and the explanation of benefit forms from the insurance company straight. And I know we have some international folks on the line today, and this will not necessarily be as helpful to you because it's a different healthcare system. But in the U.S., your insurance company is going to send you an explanation of benefits that will say this is not a bill. And then the hospital sends you a bill. And you have to match up those two to make sure that that you're not being overcharged and that your insurance is paying everything that they're supposed to pay. And that can be a very cumbersome process. So if you have somebody who's really good with numbers that you trust with that, that's a wonderful thing, a wonderful task to give a close family member or friend. And we're finishing up now. So just to take a moment, what makes caregivers effective? The healing power of the human presence. And I think that first one is the most important to me because for those of us who have trouble when we can't fix a situation, it's really helpful to remember that in studies with patients, one of the most helpful things that they reported was that they really just felt such care and love when somebody was able to just show up and be present and actually listen and not try to fix. Empathy for self and others is another huge one. Respect for themselves and others. Being authentic. Being flexible. Allowing both to participate. And being direct. What's less likely to work is trying to do it all. Pretending nothing has changed. Distancing from the situation. And not allowing room for your feelings. Your partner is usually worrying just as much about you as you worry about them. And it's also really important to have those hard conversations. The conversations that come up here for some folks are sexuality conversations can come up here. End of life wishes conversations can come up here. And differences in opinion about what kind of treatment should be followed and when to stop treatment, if to stop treatment. Can come up here. But they're important to have because they really add to the stress level if they're out there floating around. So the take home today, your loved one needs you. It's a marathon, not a sprint. And you can't do this alone. But together, you, your loved one, and all of the support team members that you can pull in can and will get through. So I'm open to taking questions.
That's great. Thank you so very much, Ashley. Lots of great information, and you've provided a wonderful segue now for questions. We do have some time for those of you participating today. If you would like to ask a question as before, if you could go ahead and type it into the question box on your screen. And while folks are kind of thinking through the questions they'd like to ask, I did just want to mention a couple things that Ashley sort of spoke to a little earlier, and that is our ABTA Connections online community, which is through Inspire. Ashley mentioned the Inspire website. Many of you may already be members of that, but the ABTA's Connections online community helps to link patients, families, friends, caregivers, even healthcare professionals with each other for support and certainly for inspiration. It was originally created to help provide members with a safe place to visit, to join, and to interact with members of the brain tumor community nationally and all over the world. Just this week, we officially have added 1,500 members, truly from all over the world. It's a great sort of online support group forum with wonderful peer support and a sense of online community. So if you're not already a member, I'd certainly encourage you to become one, and of course it is a free service offered by the ABTA. The other program that I wanted to mention real quickly that Ashley also mentioned earlier is through Lots of Helping Hands. The ABTA did recently launch a program called My Caring Link, which is powered by Lots of Helping Hands, and as she mentioned, it does provide a calendar function for those of you who might need assistance with meal help or babysitting or transportation to medical appointments. That's something that you can organize and sort of ask your social circle, your family circle, to pitch in where it's appropriate. It also offers a blog feature. So it's a really great way to stay connected and to get that help that you need. So I just thought I'd mention that. And that can be accessed, both programs can be accessed through our ABTA website, which again is www.abta.org. And certainly you're always welcome to connect with our care line and our care consultants through our 800 line, which is 1-800-886-2282, or you can email us at abtacares@abta.org. So with that, we do have a couple questions that have come in. The first one asks, do you know of any websites to find employers willing to work with caregivers who work from home and have to take care of other people long term?
Oh, wow, that's a great question. I don't know of any particular websites that where that is the primary focus, is to list employers who are willing to be flexible in that way. There are some places, I don't know if you're familiar with the National Family Caregiving, it's www.nfca or www.familycaregiver.org, but that would be the website that I would go to find information about that type of thing, because they've been a huge advocate now for a number of years around all caregiving issues, not just specific to brain tumors or cancer, but all caregiving issues.
Our next question comes from Becky, and she says, do you have any suggestions for how to get a GBM patient, specifically my husband, to be willing to discuss end-of-life issues? She says that he's very positive, but unwilling to discuss his end-of-life wishes.
Becky, that's a phenomenal question, and it comes up a lot. And kudos for you to you for asking it and for keeping it in mind. I've tried a number of different things over the years and had different folks that I've worked with try a number of different things. In part, there's one of the things that has worked for some is maybe not to do really detailed end-of-life care work in the beginning, but simply for both folks to sit down, so to say, look, I'd really like to fill out my advance directives because I may not be here at some point, and you may need to know, and so to do it as a partnership or as a couple, that's often a good starting place. I've also found over time that there's a little bit of leaving the door open, saying, this is something that I'm willing to talk about. I understand you don't want to talk about it right now, but I'm here when and if you're ready to talk about it. And depending on your relationship with your loved one, you can say, I would really like to know, because it's going to be really hard if you get hit by a bus tomorrow and I don't know what you want. So to really clarify that. But to leave the door open so that they can talk about it when they're ready. And I guess my own experience has been that when that door is left open, most folks do get ready. Unfortunately, one of the challenges, right, between caregivers and care receivers or brain tumor patients is that we don't always cycle on the same timetable. So sometimes caregivers are ready way before patients, and sometimes those with brain tumors are ready way before their loved ones, and it can be hard to get those matched up.
Thank you. The next question comes from Diana, who lives in Indiana, and she asks or says, my mother has glioblastoma and my father takes care of her. Is this information available in print for me to give to my father? And I'd like to go ahead and respond to that, if I may. The ABTA does offer an extensive line of patient-friendly publications covering GBM and a variety of other topics. So for anyone who is interested, you can certainly check out our website that I provided earlier, or if you'd rather give us a call, we'd be happy to mail you a hard copy of really any of our publications that you might need or would like to share with family members or other friends. Similarly, someone asked about support groups and how do they find out if there are support groups in their area. Again, our website does provide a state-by-state listing of support groups, so if we are aware of one in your area, we certainly have it posted for you. And if it's not on there and you know about one, please let us know. We'd like to try to, we do our due diligence in trying to keep this list updated as much as we can, but certainly there's groups being added all the time. The next question comes from Debbie, and she asks, how do you respond when someone with GBM, a loved one, says that you don't understand what I'm going through? How do I learn to understand? How do I learn to respond to that person?
Oh, what a beautiful, caring question that is, and that is a very it's a tough question to hear sometimes when you're going above and beyond, it feels like, and really wearing yourself out as a caregiver. I think that the way that I typically respond to that is, you know what, you're right, I don't have a brain tumor, and I can't know what it's like to be in your body, but I really do want to be of help to you or of service to you, or I really do love you, and I really want to be as supportive as I can. What's that going to look like? What is it that you most need? And getting back to those connecting questions of not assuming, but really listening hard to what it is that your loved one really wants. And at the same time, not losing your own needs in that process. And so it's a negotiation process. I will often say to folks who, when I have the privilege of doing some couples counseling with couples who have brain tumor, where one of them has a brain tumor, I will often say having a brain tumor doesn't give either one of you a pass. You still have to work together as a couple, but it does mean that you're going to work together differently.
Thank you so much, Ashley. Unfortunately, we have come to the end. We do need to go ahead and wrap up. I want to be respectful of Ashley's time and your time, everyone who is participating today. As I mentioned earlier, for folks who did sign on a little late, we are recording the webinar today. It will be posted shortly to the ABTA website, which again you can see on your screen there. We hope you'll plan to join us again soon for our next webinar. Again, Ashley, thank you so much. Ashley Varner of the DeSeris Cancer Institute at Anne Arundel Medical Center in Annapolis, Maryland. Thank you very much for sharing your expertise and wisdom with us and for responding to the questions provided by the audience today. Again, we do invite all of you to check back at our website for other brain tumor related topics in our webinar series. Our next webinar is going to